Come in.
Hello.
Hi.
Hi, my name is Tammy. I'm a nurse practitioner student here with Dr. Jones.
Okay.
And what is your name?
Joe Williams.
Joe Williams. Nice to meet you, Joe Williams.
Thank you.
Are you familiar at all with what nurse practitioners do?
A little bit, yeah.
Okay, all right. Well, what seems to bring you to the office today, Joe?
Well, I basically am here because I was told that I might die in 2 years if I don't quit smoking.
Yeah. All right. So you would like to quit smoking. That's a good decision to make. So I see here that you have COPD.
Yeah.
You've had that for the past 15 years. And you are currently on oxygen. How long have you been on oxygen for?
2 years.
2 years, okay. And how much are you on? You're on
2 liters.
2 liters, okay. All right, and you currently smoke. How much do you smoke?
Well, right now, let's see. I smoke about a half a pack a day.
Okay. And how long have you been smoking a half a pack a day for?
Oh boy, let's see. Well, when I started smoking, I was 16, and I probably smoked 2 packs a day till I was 40, and then I went to a half a pack till maybe I was 44. Then I quit for 3 years, and then now, since I was 47, about a half a pack a day.
Okay, all right. Now, when do you usually smoke those cigarettes?
Well, when I wake up in the morning, I like to have one. After meals, before bedtime, and then sometimes I just feel like having one when I wake up in the nighttime.
Okay. Do you smoke in the house, or do you smoke in the bedroom, or
no,
in your
I go
vehicle?
outside.
Okay, good. Now, have you tried to stop smoking before?
Oh yes, like 6 times.
Okay.
But just the best I've ever done was when I quit for about 3 years. But I just have a lot of stress in my life, and that's when I start to come back to smoking.
Okay, so you have a lot of stress. And that's what you use as a form of stress reduction?
Yeah.
Okay.
It helps relax me.
All right. Have you thought about the positives and the negatives about smoking?
Yes, definitely. Well, they told me I might die if I don't quit. And then, but it's just something me and my wife do together, and that's like our little social activity, and I like to have them when I drink a beer, and but I don't really like the way it smells. People complain, and I don't like the amount of money it costs, plus the cost of this oxygen. And then when I do smoke, I gotta take off the oxygen. So yeah, it's there's definitely a lot more bad than there is good.
Okay. Now with smoking, do you have coughing associated with that?
Oh yeah.
Yeah. Do you cough up anything when you do cough? Do you notice what color it is?
Oh, like a yellow brown.
Okay. So I see you've had COPD for the last 15 years. Do you have any other past medical history at all?
Oh, yes. Where should I start? Let's see. Well, I get bronchitis at least a couple times a year.
Oh, goodness.
Let's see. I'm a retired fireman, so I've had a lot of smoke inhalation injuries I've been hospitalized for. I've had my tonsils out. It was in a car crash, so I had some broken ribs. What else? I get gallbladder attacks every once in a while, and I had a bad burn injury. I had bad burns to both all my face, my legs, and my hands. And let's see, I've had some history of pneumonia.
Okay. Do you use anything for the bronchitis you get twice a year, or
I do.
Your COPD, do you have any treatments at home that you use?
Yes, I do. I have a nebulizer.
Okay.
An inhaler.
Does that seem to help?
Yeah.
Okay, all right. What about any allergies? Do you have any allergies to any medications?
Nope.
No. Any foods?
No.
Nothing in the environment allergic to?
No.
No. Okay. What about latex?
No.
No. Okay. Medications wise, what kind of medications are you currently on right now?
Oh lordy, about 18 pills. I don't know. You would have to look at my chart for that.
Okay, all right. I'll do that. What about in your family? Do you have any family medical history? Anybody in your family have any heart problems, diabetes, cancer, anything like that?
Well, let's see. Where did I start? Well, my granddaddy, he had lung disease, and then I think he had a heart attack and some heart failure. And then my mom and my brother both died of lung cancer.
Okay.
So that worries me. And then my dad was a firefighter too, and he died of bladder cancer.
Okay. Now you mentioned that you smoke as a way of relaxing with your wife. So you're married.
Yeah.
Okay. You said you're a retired fireman.
Yeah.
Do you do anything else, like any part-time work or anything like that?
No, I'm on disability and Social Security.
Okay. All right. Now you mentioned you do drink some beer with your wife to relax too when you smoke with them. How much do you drink, would you say?
Probably just a couple beers a day.
Okay, all right. Now,
probably a 6-pack if you add them up.
Okay. What about ways of quitting? You've mentioned you've tried to quit in the past. Have you used any form of treatment in the past, like pills or patches?
No, I haven't.
Or anything like that?
But
okay.
I would like to try something. I'm up for anything.
Okay, all right. So I'm just going to ask you a couple of questions before I do an exam, okay?
Okay.
Have you had any recent illnesses besides this bronchitis that you get occasionally?
No.
No, okay. Your medications, any changes with your medications since the last time you came to the doctor's office or
Nope.
been seen? Okay. What about any anxiety? Do you feel anxious at all?
No.
No. Irritable?
No.
Any increased hunger or loss of appetite?
No.
No. Okay. How about your sleeping habits? Any problems sleeping or getting too much sleep?
No.
No. Okay. Concentration-wise, have you been able to concentrate or have you been distracted easily?
No, I feel that's fine.
Okay. Any problems sleeping? Can't fall asleep or anything like that when you do fall?
I wake up pretty easily, but
any tremors or sweating?
no.
Night sweats at all? Dizziness, lightheadedness?
No, not that I can think of.
Okay. So I'm just gonna look over and do a physical exam.
Okay.
And then from there, I'll discuss with you some ways to quit smoking, and
Okay.
I'll go over the exam with you, okay?
Okay, thanks.
I'm just going to grab my stethoscope here. Okay. Let me clean my hands. So the medical assistant came in and did some vital signs when you first came in. Your blood pressure was 146/90. Your temperature was 98.2. Your heart rate was 98. Your respirations were 18. I see they also weighed you and measured you before you came into the room here. And then at a previous visit, I see that you had a spirometry test done. So that looked okay. All right, so first I'm just going to kind of look you over and look at your skin, see if there's any rashes or anything like that, or any edema. I'm just going to touch your legs down here, okay? And then your hands, I'm going to just check for that. And check your capillary refill, which is just your circulation level, to see where that's at. Okay, good, good. Any rashes that you've noticed?
No.
No. I see you have some old burn scars.
Yeah.
And that's been previously noted. You have burns on your hands too, and that's from when you were a firefighter?
Yeah.
Okay.
On my legs.
Okay. What about when you walk? Do you have any shortness of breath or anything like that when you're walking around?
Once in a while.
Okay. So I'm just going to take a listen to your lungs first, okay?
Mm-hmm.
So normally I would do this when you're in a gown, and it would be from skin to skin, but unfortunately don't have a gown available today, so I apologize for that. I'm just going to listen to the back here. And you take a deep breath every time you feel the stethoscope touch your back, okay? If you have any discomfort or anything like that, please let me know. Listen to your front here. Deep breath in and out. Good. Listen to the side here. To the other side. All right. I'm just going to listen to your heart sounds too while I'm here. So you can breathe normally. Just going to listen with both sides of my stethoscope. And that's so I can get a good sound. All right, can you lean forward for me too? Wonderful, thank you. Okay, so then I'm just going to do a couple of things. To your back side, I'm just going to touch back here and tell me if you feel any tenderness, okay? Any tenderness there?
Mm-hmm.
No? What about
No.
here?
No.
No? Okay. So I'm going to have you take a deep breath in for me. Good. And out. Wonderful. Okay. I'm just going to do a little bit of something called percussion, okay? Any pain at all when I'm doing this?
No.
No? I'm going to do this on the front as well, okay? You can just breathe normal. Okay. And then I'm going to do something, it's called whispered soliloquy.
That's a fancy word.
It is. So what I'm going to have you do is I'm going to listen to your lungs again, and then every time you feel the stethoscope touch your skin, if you could just say 99 for me, okay? And when you say that, kind of say it in a whisper, okay? Okay, go ahead and whisper. And if you could do that again here in the front. Good job. Okay. So what I want you to do is I want you to lay back for me if you could. I'm just going to take a peek at your abdomen, at your stomach, okay?
Okay.
I'm going to open that up. And first I'm just going to inspect it. Have you noticed any kind of lumps or bumps or any pulsations or anything? No? Okay. All right, so I'm just going to look at that. Okay, looks pretty good. I'm just going to listen for some bowel sounds, okay? Good. Nice and gurgly. All right, and then I'm just going to feel around, okay? Any pain at all?
No.
No. Any tenderness there?
No.
No. What about back here? Any tenderness at all?
No.
No? Okay. All right. And there?
No.
Okay. I'm just going to look at your neck veins too. Make sure that they're okay. All right. Just going to do a little bit of measurement. Okay. All right. I'll have you sit up for me again.
Okay.
Thank you for that. So, how is your bowel habits? Any problems going to the bathroom or anything like that?
No.
No? Okay. Your last bowel, do you go regularly every day?
Mm-hmm.
Okay, all right. So, going back to quitting smoking, we can try a variety of things. I think that's very good that you would like to quit. That's a good thing, especially with oxygen. Oxygen is flammable. So when you smoke, do you smoke with the oxygen on?
No, I take it off, but
Okay.
you know, but then that doesn't help either.
Okay. Yep, it's you know, it's good that you take it off beforehand because it is flammable.
Okay.
And then that would cause more burns.
Oh yeah.
However, taking it off to smoke too isn't always the wisest decision. That, you know, doesn't help with shortness of breath or anything like that. Okay. So we could try, you know, patches or pills, whatever you prefer. Is there one that you prefer over the other?
No.
Okay.
Whatever, I'll try it all.
Okay. Well, we can prescribe a medication for you, you know, and to help you quit.
Great.
It's important too that if you have any side effects, any problems with that, to let us know.
Okay.
And try not to smoke while on that medication. Okay. Stress-wise, stress management, I would encourage alternate forms of stress relief besides smoking. Is there something that you like to do on your free time that would better?
I'm gonna need to get some hobbies.
Okay. Yep, you just kind of partake in any kind of hobbies that you have with your friends, and that should, you know, distract you from smoking as well.
Okay.
There are also support groups that you can join.
Okay.
Where people that have the same issues. You can speak with them and get first-hand experience with that, first-hand information. Also, drinking beer, you know, it's okay to do occasionally, but kind of watch your intake on that too, just for your overall health. That would make you feel a little bit better as well. You know, eat right, eat healthy, more fruits and vegetables, and get some exercise. Okay. Start slowly at first with the COPD and lung problems. We don't want you to overdo it and get shortness of breath. Just stop and rest occasionally. Okay.
Okay.
Do you have any questions for me at all?
No, I have not yet.
Okay.
Not right now.
If you have any questions at all, please feel free to get a hold of our office.
Okay.
And then we'd like to see you back too as a follow-up to see how the medication treatment's going. Okay.
Okay.
All right. Well, thank you very much.
Thank you.